Good evening, ladies and gentlemen. Welcome to Thursday's edition of Community Health Screen UK. My name is Dr Mekella Mehmet Yesil, and I'm broadcasting live from Enfield. Today on our programme, we're going to be introducing Professor Ahmet Karabulut from Turkey, who's going to be joining me now. And he's going to be talking about wellness and cardiology, and basically a little bit about the general health of our individuals, basically about ourselves, for both men and women. Welcome, Professor Karabulut, to the show. Thank you for joining me today.
Okay, thank you very much. Initially, I'm appreciating for your kind invitation. It's an honor to be with you here.
Thank you
today,
so much.
Yes, today you said that we will mainly talk about the basic principles of the healthy life.
That's it. The basic principles of a healthy life. That's exactly it. Right. Before I start, Professor Karabulut, if I can ask just a little bit of, if you can tell our viewers, the people who are watching us today, a little bit about yourself, what you do, what your speciality is, because we know you're a professor, and you're also based in Istanbul. Is that correct?
Yes, I'm working in Istanbul, and my profession is cardiology, and my experience is nearly 20 years. I'm graduated from the Hacettepe University. It's one of the well-known faculty of medicine in the worldwide in the millennium 2000. And after that, I just chose the cardiology residency. And now currently, I am working in the Acıbadem University. I am also a lecturer in the university, and also I'm a hemolytic cardiologist. I'm intervention cardiologist. We are performing angioplasty stent procedures and also the transcatheter vein replacement, and also the other procedures for the congenital heart disease. But besides this, we are also performing the clinical cardiology. It's more important for us because especially the cardiovascular disease is most important disease in the worldwide, because it's the most important cause of mortality, because nearly one third of the death is coming from this cardiovascular disease, and every year approximately 18 million people is dying from the cardiovascular disease. This is myocardial infarction and stroke. I'm a hemocardiologist, and I like to perform the angioplasty, stent procedure, etc. This is secondary prevention. The more important thing is primary prevention, to prevent the occurrence of such disease, to prevent the occurrence of vascular disease, vascular hardening. This is more important. And with the healthy life, today we will talk about performing the basic principle of the healthy life. You can decrease the incidence of such a cardiovascular disease at least 50%.
Okay, that's very interesting to hear, Professor. Very interesting indeed. Now, you're going to tell us a little bit about other things as well, obviously to do with the health in general. But what I'll do, now you've explained a little bit about yourself to the viewers that are watching, if anything comes up on my screen and people want to ask some questions, I'll relate them back to you, Professor. Is that okay?
Yes, it's okay.
Okay, I'm going to start with the first question for the evening then. Right, what is it you're doing in your clinical practice which is proving effective?
Yeah, especially I am performing the cardiac procedure with the higher risk. Complex cardiovascular intervention. I mean, left main coronary artery intervention with patient lesion, multivessel vascular stenting, and also the chronic total occlusion is a challenging case for the cardiac intervention. I'm usually performing the high-risk patient. Besides this, we also performing especially the atrial septal defect closure, and the TAVI is the transcatheter aortic replacement. It's a very new therapy, especially for the aortic stenosis. Yes.
What sort of age groups do you operate on, Professor Karabulut?
Actually, especially for the TAVI procedure, they are very elderly. The
elderly? What age group are we talking about roughly?
It's about 75.
75?
Yes, but for the stent procedure, for the vascular hardening, the age is very young. Believe me, in the age of the 30s, there's a lot of patients with the heart attack and heart disease.
What
So,
ages are you seeing the heart attacks, Professor Karabulut?
especially,
What age would you say is average in this day and age to get a heart attack?
Yes, it's normally the heart attack is the incidence increase with the age. So
Okay.
the elderly rate is higher.
Okay.
And especially in my students' years, usually we said that the cardiac disease is more common over the 50. But
Over 50, yeah.
Yeah, but today, especially over the age of 40, the risk prominently increase. Also, there's a risk factors. Factors, especially sedentary lifestyle, smoking, alcohol consumption, obesity, and having the chronic disease like diabetes, cholesterol, and also hypertension and the kidney disease. This all increase the risk. So yes, if you have such a risk, as also if you have a genetic predisposition,
a predisposed gene or something.
It means that you have a higher chance to have a heart attack in the earlier age. Early age. But if you perform the all the principle of the healthy life, so this age will be, I think you will postpone to face with the heart attack. This is very important.
Yeah, you can prevent it and delay it.
Yes. So this is my motto. I think especially the life is education. I said that.
Absolutely, 100%.
Yes, the life is lifelong, is the activity, is education. Yeah. I said that, learn it, experience it, and share it. Sharing is very important. Sharing is very
I completely concur with you on that one. Absolutely, yes. So it's about educating people to change their lifestyles, to change their eating habits, to change the way that they feel about exercise and food and everything else, and obviously eliminate stress. That is the biggest one. There is no such thing as anybody having a stress-free life, because I'm sure we will experience stress regardless of man or woman, younger or older.
Yes, you are right. So I said that the primary prevention is more important. For this reason, I just performed 2 projects. The first project is my book project is about the cholesterol. It's lies because the cholesterol, the higher cholesterol, play a central role in the vascular hardening, in the vascular occlusion. Yes, and my secondary project is the wellness score.
The wellness scorecard, that's right. The biometric measures.
Just like a school reports, just like
it's like a school report. Oh, okay, so it's a point system. So you have to tick it off.
Yes, and in this wellness score chart, there is a subheadings, and the number 1 is the exercise.
Is the what, sorry?
Exercise.
Okay, that's something we haven't all been doing, but
exercise should be in the center of our life, because with the regular exercise, you decrease the risk of heart disease, hypertension, cancer, diabetes, also depression. With the exercise, not only the heart disease, also you decrease the risk of the depression, diabetes, a lot of this.
Because the chemicals in the body, the serotonin, the oxytocin, the endorphins, the dopamines, all those things play a crucial part.
But the regularity of the exercise is very important. You should perform at least 4 days for a week. So
4 days over a 7-day week,
Yes, and it should be at least 30 minutes. And
30 minutes for 4 days.
60 minutes, yes. So the regularity is important. Some people said that I don't have enough time, and I just have a time for the exercise just for Sunday. So if you perform the Sunday exercise, for example, 3 to 4 hours, it is useless. It's useless. It should be regular. If you perform the exercise more than 2 hours, it could be harmful. So it should be between the 30 minutes to average 1 hour is enough.
So 30 minutes to an hour, maybe every other day? 1 day exercise, 1 day don't, or moderate exercise?
Yes, could be. So, walking Walking is
Walking. Okay.
but yes, but it should be brisk walking, fast
Yeah. So
walking,
yeah. Yeah.
fast walking. And beside the walking, bicycle, also
Okay.
swimming, also,
Swimming.
yes, farming, it could be dancing, especially the
Dancing
Latin
sounds
dance.
good.
Yes,
Yeah.
yes,
Latin dancing. Yeah.
yes, yes, it's good for exercise.
Okay.
Besides this, horse work, yes, yeah,
Okay.
yeah,
Yeah.
yes,
Yeah.
cleaning, etc. It could be exercise.
Yeah.
But if you don't have enough time for the exercise, in that time, you check the number of the daily step.
Okay.
So it should be at least 10,000. If you're walking more than 10,000 steps a day, it means that you have a beneficial effect from this. It's same with the
Okay.
exercise.
So
Okay.
is this mean like
Yes.
wearing the Fitbit watch or
Yes.
something, and it paces you? So it tells you how many.
Yes, no, you can check it from your smartwatch. Yes,
Mm-hmm. Okay.
smartwatch, and especially over the 1,000, 10,000 step is very beneficial. But
Mm-hmm.
below the 5,000 step it means that you should walk. You should
More.
walk. Yes,
More.
so you should walk more. In the evening, just check your daily step. If it is below the 5,000 and directly go outside and please reach at least 5,000 steps.
5,000. Okay.
Yes,
That could be
yes,
going up the stairs or something, or even
yes,
mowing, cutting the grass in the garden, or hoovering the
yes,
grass
yes,
maybe,
yes, yes,
or
you
doing
are right.
something. Yeah.
This daily step just for the people who couldn't perform the regular exercise.
Okay.
If you're performing the regular exercise, no need for checking the daily step. You
Yeah.
are
Okay.
already performing the exercise. So
Okay.
number one, the most important subject is the exercise, and the
Okay.
number two is obesity. I
Obesity.
mean,
Yeah. Well,
overweight.
we're gradually coming out of lockdown here in the UK, so we have no
Yeah,
gyms open at the moment. So a lot of people who regularly used to visit the gym are probably doing what we call brisk walking or jogging or doing weights at home or
yeah,
buying a bicycle. So we're limited to what we have at the moment, but I'm sure we can make use with what we have and what's available. So like you said, brisk walking, using a bike. I don't think we can do much swimming at the moment, but I'm sure there's other things we can do by buying gadgets or like
yeah,
a Fitbit or something. So
yeah.
yes.
So you are right,
Or
but
we can walk the next door neighbour's dog or something.
especially the obesity is a common problem of the most countries, and
Hmm.
it's surprisingly in the Turkey, the obesity, especially the woman, is the number one in the Europe
In
countries.
women.
Yes, in women,
Oh,
unfortunately.
wow.
So it means that the Turkish woman is overweight, unfortunately, and
Really?
yes, and the obesity means is impaired glucose tolerance, means prediabetes. It means
Okay, type 2
it means
diabetes. Yeah.
hypertension. It means autoimmune disease. And
Hmm.
we said that especially in this corona pandemic, the
Hmm.
the overweight patient have a more risk for the corona.
That's right, because they're moving less and they're
Yeah,
staying
yeah,
home.
yeah.
That's
And
right.
for the evaluation of the obesity, initially we will check the body mass index. In the
Yeah, the
body mass,
BMI.
yes, BMI in the body mass index, uh, we just divide our kilogram to our height. Our height should be in the
Hmm.
meters 2 times, and if our body mass index is below the 25, it is optimal.
Hmm. Okay.
It is over the 30, it means that you are obese, and if it is the over the 30, it means that you are just collecting 0 points from this subject,
Yeah.
unfortunately.
Yeah.
And
Okay.
the second thing is the circumference of the belly, abdomen.
Okay. Yeah.
Yeah,
Hmm.
because the abdominal obesity is more dangerous than the body mass index, because in the abdominal obesity there is a loss of fat in the visceral tissue, and it increased the risk of the atherosclerosis, vascular hardening, so much.
Hmm.
So
Hmm.
it means that if you have a big belly, it means that you have a risk of heart disease. So
This. Okay.
what is the threshold? The threshold is 80 centimeters for the
Hmm.
women
Hmm.
and 94 centimeters for the man.
Okay.
Okay,
So we're
okay.
talking 35 inches for a man and 30 inches for a woman? Is that right, in inches, roughly? I think
Roughly,
it's, yeah.
yes. Yeah, in the woman, the circumference should be below the 80 centimeters. Because
Okay.
over the 80 centimeters, you have a risk.
Maybe
So,
after this show, you can write all this down so viewers can see it at the bottom, if that's okay with you, Professor Karabulut.
okay, okay, it
Yeah,
could
we
be.
can share links anyway. We can do
Yes,
that. What was I going to say here? Right, let's have a look. So you've talked about the wellness score and the basic principles of a healthy life.
yeah.
What would you suggest to a mature woman in her 40s, 50s to keep a healthy weight? What would you suggest?
The most important thing is we said that number one is exercise because
Exercise. Okay,
after the 50, most of the women they just experience menopause, and
that's right.
after the menopause, with the change in the hormones, the protective effect of the estrogen will decrease. It means that the risk of heart attack, the risk of heart
Goes up.
disease increase, especially after the 50s. So
Yeah.
exercise is important, and most of the women usually gain weight after the menopause. They should keep their weight. Weight is important. The third thing is also especially with smoking.
Yeah. Okay.
Yes, smoking is a big problem for also the man as also the woman, and the woman is more susceptible to smoking comparing to men. It means that if the woman is just smoking 2 to 3 cigarettes per day, its effect equal to 6 to 7 cigarettes for the man. So
Okay.
yeah, so woman is more susceptible. And
Okay.
yeah, in my wellness score, in the third subject is smoking.
Okay.
Even passive smoking. If the
Passive smoking. So that means the cigarette of somebody else who
yeah,
does smoke.
yeah,
Okay.
there is a risk, and also the electric cigarettes, I mean IQOS, etc. They also have a risk. So
The vaping
yes,
ones.
yes, it's better to not. We said that
Smoke at
not.
all. Yeah, that's right.
yes. So
Absolutely correct
yes,
there.
and besides smoking, we usually talk about also the alcohol consumption. And
Alcohol, yeah.
yeah,
What is a
and
good amount? What is a good amount of wine? I
yeah,
mean,
yes,
because I've had people saying here that they're going to walk to the pub for good exercise or what have you,
yes,
which is quite funny. But
yeah,
then what is a healthy amount of alcohol?
yes. I initially said that for the cardiologist,
Mhm.
alcohol is equal to red wine.
Alcohol
Okay,
is equal to red wine. Okay.
for the cardiologist,
Okay.
because only small amount of red wine is beneficial, the odor is unfortunately harmful. So
Okay.
you should consume 1 glass of the red wine for the woman and maximally two for the man. But
So it's
just
one glass, not one bottle, one
no,
glass.
just 1 glass.
One
Just
glass a
one
night.
glass. Yes,
Okay.
yes. For this is daily. But
Okay.
you should keep in mind that even mild consumption of the alcohol is associated with the cancer development. It's reported
Okay.
in the Lancet. Lancet.
Yeah, that's the
But
Lancet. Yeah, I've seen a
yeah,
few. Yeah.
yeah. So if you want to take alcohol, please drink red wine. And
Red wine.
yeah, red wine.
You hear that,
No,
people? Red wine. Red wine
yes,
only. No
red
white
wine.
wine, red wine. One glass of red wine will keep the doctor
Yes,
away.
yes. And instead of the alcohol, my other subject is water.
Water. How
Water
much water
intake
should
is
we be
very,
drinking?
2 liters. It
2
means
liters minimum.
it's enough. 2 liters is enough for.
Okay.
It's equal to 10 glass. 10
10
glass.
glasses.
Yes,
Okay.
but especially below the 1 liters of the water intake is usually associated with the palpitation, shortness of breath, and risk of kidney disease, especially
Okay.
in the elderly. So water intake is very important. Some people said that I am drinking a lot of coffee, tea,
So
etc.
that's yeah. It's
They
not
are
the same
not
thing. It
not
dehydrates you.
yes,
It
because
dehydrates you.
the all of the other other drinkings have a diuretic effect, and they cause dehydration. So the water intake is more important. And beside the water, my next heading is sleep.
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 Okay.
Yeah,
How much sleep should we be getting?
Yes. So it should be at least 6 to 8 hours. And
6 to 8 hours.
the quality should be good. So
Okay.
below the 6 hours is risky. Also above the 9 hours also the risky. So
Okay.
for the good quality sleep, you should go to bed just in the midnight between the 11 p.m. to 1 a.m.
Okay.
After the 1 a.m., the quality of the sleep will decrease.
It depreciates, doesn't it?
Yeah,
It goes
yeah.
down. That's right.
So disturbance in the sleep associated with the high blood pressure, high cholesterol, palpitation, and also depression.
And going to
And
the toilet.
yes, yes. And sleep is the only period that body have a rest, and sleep is the period that body repairs.
Repairs itself. That's correct. Yeah. Yeah, that's right.
It's very important. And my next heading is stress.
Okay, stress.
Yeah,
Who doesn't
yeah,
have stress right now?
yeah. And this question is important because we couldn't define the stress load of the everybody. So we usually ask this question: your life is, you feel stress minimally, moderate, or severe. So if you have a moderate and severe stressful condition, you should need a help from the physician. Okay, because stress is associated with autoimmune disease, especially cancer, hypertension, arrhythmias, and also the heart attacks. So stress is very important. Actually, minimal stress, mild stress is good for the reinforcement
Yeah.
during the life. But if the stress is moderate and the high, it will be a risk for you. And my next heading is the blood analysis, especially for the cholesterol and especially for the sugar.
Okay.
Without the blood analysis, you couldn't know whether you have a diabetes or whether you have a high cholesterol, etc. So I think it's in a year. Just check your blood glucose, cholesterol, and kidney and the liver function if there is a normal or not.
Yeah.
Because
Just a full blood count at your GP or your local
because
hospital.
especially some disease could be asymptomatic. It could be silent. It could be silent.
Yeah, usually very silent diseases. That's
Yeah,
correct.
yeah.
Yeah.
So
And obviously
blood-
vitamin D and vitamin A as well.
especially vitamin D. I will come to that also.
Okay.
Also the blood pressure measurement. Blood pressure measurement is important because 1/3 of the hypertensive patients, they don't aware of they have hypertension. And
Okay.
the only way of the diagnosis of the hypertension is the correct blood pressure measurement.
Okay. And a lot of people don't know what the average should be. Would you like to
Yes.
tell people what the average blood pressure is for, say,
Yes.
a 40, 50-year-old?
Yes, we have a threshold. The systolic should be below the 135, and the diastole small one should be below the 85.
That's right, yeah. I think it's gone up. It used to be 120, 70, but they've moved it up a little bit now, haven't they?
Yes, above this threshold, it means that there is a hypertension.
Okay. And the blood, the heartbeat, if they don't have trachea or something, it should be about 80, 85 beats per minute, 77, depending.
Especially the heart rate, its pulse rate should be in the rest period, it should be below the 80.
Yeah, that's right.
So
So anything
during-
over 100 is not good.
Yes, during the rest is not good. But during the exercise, we like to increase our heart rate.
That's right,
Because-
that's right. The
yes,
cardiovascular rate.
Yes, it's the cardio exercise. During the cardiovascular exercise, we usually increase our heart rate between 120 to 150. It depends on the age. But during the rest period, our pulse rate should be low.
That's
below
correct, yeah.
Yeah. And my next subject is the time of dinner.
Time of dinner. That's important because a lot of people eat late and they go to bed straight away. So elaborate for us, Professor.
Yes, it should be before the 8 p.m.
Before 8 p.m.
Yes, because if you have a dinner in the late time, it could disturb your quality of the sleep.
And indigestion as well.
Yes, and
And
also
heartburn.
yes, also you are right. So the time is very critical for the dinner. It should be before the 8 p.m. And we talk about the dinner. It's correlated with also the salt intake. The
Oh
daily
yes,
salt intake,
sodium.
yes, very important sodium because especially in the Turkish population, we consume salt nearly 3 times more than an average. So, so daily for us, the daily just 1 teaspoon is enough for us.
1 teaspoon a day.
Yes, it's enough
Okay.
for us. Yes, yes. No need for the normal spoon, etc. Just 1 teaspoon. And you said that the vitamin D. So the vitamin D means especially the sunlight and the sunlight.
Because
It's
it
also
resets the
yes,
brains
yes,
to
yes.
sleep.
Yes, very important, and especially just taking the sunlight 20 minutes per day,
Today.
especially near the noon time, is enough for the vitamin D, especially in the summer and in the spring season. But especially in the autumn and in the winter, you should check your vitamin D level and you should take the supplements because in the
Supplements, vitamin D supplements.
yeah,
Yeah,
in the winter season, the sunlight is not enough to
that's
increase the
right.
vitamin D. Yes,
That's right. And we also need vitamin D to help with the absorption of zinc and vitamin C as well. Is that correct,
yes,
Professor?
yes, yes,
Because our
yes, yes,
body can't store it, we need to take it regularly.
yes,
Vitamin C and zinc. Is that
yes,
correct?
yes, yeah, you are right. And my
Yeah.
next subject is oral hygiene. I mean,
Oral
toothbrush.
hygiene. Of course, of
Yeah,
course.
toothbrushing, because there is the direct correlation between the especially uh, 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 especially the microbes in our oral cavity and also the vascular hardening.
That's correct. Yeah.
Yes, if you don't care about your oral hygiene, it means that there is a chronic inflammation here.
Okay. Yeah.
Yes,
Inflammation. Yeah.
yes, which triggered also the vascular inflammation and
That's
vascular
right. It
hardening.
causes calcification in the
Yes,
vessels.
yes. So we said that please at least 2 times just brush your teeth.
So you hear that, ladies and gentlemen? Twice a day, brush your teeth,
Yes,
keep oral hygiene clean, stop the
yes,
build-up of plaque and the plaque getting into your blood vessels, because that's what happens. Is that right, Professor?
yes, you are right.
Yeah.
And my next subject is pets. Just
Pets.
look, yeah, look after the cat or dog. Uh, they are very helpful because
Okay.
they decrease our risk, the
They help
stressful
with stress
conditions.
levels. Yeah.
Yes, and especially also for the dog, they help us for the walking, performing
Okay. Yeah, that's
exercise.
very true. That's very true. Yes.
Yes. So it's interesting having pets associated with the lower cholesterol level.
Wow. That's interesting to know. Yeah.
Especially that just cat is. I like cats instead of
Yeah.
our dog. Yes, they directly decrease our stress levels.
They
So
do. They do. Yeah.
yeah, so pets having
They say
pets means
petting the pet or stroking the pet
yes,
actually helps with
yes,
reducing stress. That's right. Yes.
yes.
There is some
Uh,
research behind that.
Yes, and my next subject is smiling and laughter.
Okay.
Yes,
Lovely.
yes, because also the smile is associated with decrease the stress level. So just smile to everybody. Just
That's
have
absolutely correct.
a
There
big
is
laugh.
something behind that because they say it takes
Yeah,
less muscles to smile, but if you frown, it takes more muscles, so it makes
yeah,
you more wrinkly. Is that correct?
yes, you are right,
Yeah.
but
Yeah.
uh, your whole body you should smile.
Yeah. Your whole body. Yeah.
Just
So you should
smiling off the
glow.
lips.
We should
Yeah,
glow.
just smiling off the lips is it's not enough. Yes,
Yeah.
you should your whole body should smile. And
Yeah.
finally, we talk about the diet.
The
Yes,
diet. Okay.
the diet is very important for us,
Of course.
especially the consumption of the fish and also the
Fish, oily fish. Yeah. Omega-3,
yeah,
6, and 9.
yes, the omega-3 is important for us, especially the salmon, especially the salmon.
Salmon, mackerel, tuna.
Yes, yes, it's rich with the omega-3, so we should consume fish at least 2 times a week, 2 times a week. And please do not grill the fish. it should be in the oven. It's better. If you grill within the oil the fish, so the you you can decrease the level of this omega-3.
Oh, I
Okay.
see. So
Okay, no grill
pan,
for the
just put it in a
fish.
pan and just turn
Yes,
it round.
yes,
Yeah,
yes,
in a
yes,
pan.
yes,
Okay, because it
yes.
reduces the oils come away if you grill it or barbecue it. You mean unless you put
Yes,
it in
perfect.
foil or
Yes,
put it
you
in a
are right.
foil and cover it up,
Yes,
so all
yes,
the nutrients remain inside.
yes, yeah. And besides the fish, we also should consume meat. Why? For the protein. Uh,
Hmm.
because in the diet, there should be balance between the protein, carbohydrate, and the oils. This
Well,
is
we need it for
important.
amino acids. Yes.
Yes, yes. And for the meat consumption, especially if you have a heart disease, the 100 gram is enough for,
A week
for, for a day.
for
For
a
a
day.
day.
Okay. Okay.
Yes. If
So we're
you,
not
if,
saying cut out meat
yes,
completely, but
yes, yes,
reduce your
no, yes,
consumption of
yes,
red
yes,
meat.
yes, reduce. And you shouldn't consume the refined meats. Just
Okay.
consume fresh meat.
Fresh meat,
Fresh,
not frozen
yes,
meat. Yeah.
yes,
And
fresh
not
meat
processed
consumption is, yes,
meats.
yes, no process, especially the
No
processed
beef
meat.
burgers or sausages.
Yes, you are right. And besides this, you should consume at least uh, two plates of the vegetables and also the fruits. Vegetables and
Okay.
fruits is important because there's a
And beetroot.
important, yes, yes,
Beetroots and sauerkraut are very good for us. We call it turşu in Turkish, but I
yes,
think in
yes.
English it's just mixed vegetables in sauerkraut, which is very
Yes.
good for the gut health as well. Isn't that correct?
Yes, because it's fermented food.
Fermented foods and
Yes, yes,
yogurts,
it's good, but it has a unfortunately higher salt level. So it could
unless
be,
you make it yourself.
yeah, it could be problem for the hypertensive patient.
Okay.
Hypertensive. Otherwise, they can consume.
Hmm.
They can consume. And my favorite fruit is pomegranate.
Hmm.
Pomegranate is
Pomegranates, yes, it's an
yeah, yes,
antioxidant.
yes. It's I think it's the best fruits for the heart.
Yeah,
Heart. Yes,
absolutely. And it's
pomegranate.
got medicinal value. And they say, I remember reading something when I was studying many years ago, dietary foods. The darker the fruit, like blackberries, blueberries, raspberries,
Yes,
strawberries, the
yes,
darker, the higher the antioxidants. So it means it's better for you, your heart, your
yes.
kidneys, and your liver. So you
You are
secrete,
right.
yeah.
It should be dark. It should be red to purple. Red to
Hmm.
purple and dark. It means they have a higher antioxidant
And
capacity.
ackee berries as well has got very good
Yes,
antioxidants.
yes, you are right. And especially during the dinner or during the meal,
Hmm.
we usually drink something.
Hmm.
Somebody they prefer alcohol or Coke or orange juice,
Fresh
fruit
orange
juice,
juice is
fresh.
good, yeah.
Yes, but I think the water is the best drinking with the
Absolutely,
yes,
absolutely. Yeah,
yes, yes. Please prepare water with the meal. Okay.
absolutely.
Yes, the other discussion is about the egg consumption because they said that the egg consumption increased directly the cholesterol.
Hmm.
But the studies showed that just one boiled egg per day is do not increase the risk of the heart disease. So
Okay,
you can eat just one egg per day because it also have a high protein in
that's right. And it's good
yes,
for the brain as well,
yes,
brain
yes.
health.
So
Okay,
you can eat egg in boiled, but not with the processed meat, also with the refined meat. Just
okay,
just consume egg in the boiled form. Okay.
okay. Well, I was going to say, Professor, we have like 2 minutes left. So if you want
Yeah.
to round up for me and
Yes,
finish off what you're
yes,
saying.
yes. And my especially in the diet, we said that we should decrease the sugar also.
And
Sugar is
processed
important.
food and saturated
Process,
fats.
yes, we should usually ask that you are putting the sugar your tea or coffee. If you can drink the tea or coffee without sugar, you said that you are not sugar dependent.
Yeah,
Okay, you are not
yeah.
abuser.
Hmm.
And also the yogurt and the kefir consumption is important, especially for the probiotics. and you should be away from the, especially the fried chips, fast food, etc. And also the bread. You shouldn't consume white bread
So
because
more brown
yes,
bread,
yes,
fiber, high
yes, yes,
fiber.
yes. And what about the oil? The olive oil is the most healthy oil.
Oh,
Olive
the
oil.
healthiest oil.
This, yes,
Okay.
yes. It's beside this olive oil, you can also consume the other plants oil. Okay, but
Okay.
we should decrease our butter consumption. It's
So
very,
butter.
yeah,
Okay.
and no margarine. Okay,
And no margarine. Okay.
it's
Okay.
important.
So you've heard
And
it all
the,
today.
yes, and this is the end of the my wellness score. This is the first version. Now I'm working on for the second version. In the second
Hmm.
version, there is also reading. There is also the time for the social media, digital, etc. Now
Okay.
I'm just working on the second version, but it is the first version, and I think it's very good for assessing the our wellness. It's, I
Okay.
think,
I
yes,
think it's a terrific idea, Professor
yes,
Karabulut. It's been amazing having you on the show. I'd like to thank you personally, and I'm sure our viewers as well, people who've been watching the show. I've seen some comments here on the right side where I've been looking. Some people saying, hi, welcome on the show. You're the best. It says, my learning program, very interesting, from Bernadette Woodland. Walking to the pub is good exercise, she's put on there. Can I finish the white wine first? Very informative. He's out talking me. Usually I talk a lot, but obviously you're out talking me today. Dr. Kaya, he said perfect as well. And then obviously again, Bernadette wouldn't eat your greens, she's saying, so which is good.
yeah.
But I'd like to
Yeah,
thank everybody for watching
yes,
and
thank you very
thanking
much.
you.
They can ask a question, especially in the social media, in the
If
Twitter
you tell us
or
what your social media
yes,
is, add the
yes,
link and we will put it to the end
Twitter,
of the program.
Twitter and also Instagram. They should just put the hashtag of Kalbini Sev. And
Oh, hashtag Kalbini Sev. That
yes,
means love your heart in
yes, love
Turkish.
your
So they can
and
follow you, Professor.
yes.
Okay,
So thank
thank you so much for coming on my show. I really, really appreciate it. You've been very informative and it's been very educational to everyone who's been watching. And I'd like to thank everybody and hopefully I'll see you again soon. Thank you so
okay.
much, Professor.
Thank
Thank you so
you.
much. God bless you. Thank you.
Bye.
Thank you. Bye-bye.